Advances in science has shown clearly that addiction is a disease, it's a brain dysfunction. In fact, it's been defined as being a chronic relapsing brain disorder. Um, this is good news because it can inform our policy and how we treat people by delivering appropriate interventions. I think the problem at the moment, and from what I've seen in the UK, is we are delivering interventions that solely are based on treating people who have a problem with drugs or maybe have a problem with alcohol. And what science in addiction has shown is that there actually is a difference between substance misuse and addiction. And this is a definition that is really, really important because at the moment in the UK we're spending billions upon billions upon billions treating addicts with the wrong treatment. We're putting interventions in place for addicts that work quite successfully for people who may have a problem with drugs or may have a problem with alcohol. However, they won't work with someone with addiction. The reason they don't work with someone with addiction is anyone who's got a problem with drugs and alcohol is actually suffering from a behavioural problem. On the other hand, and in stark contrast, anybody who has addiction who don't have a behavioural problem, they've actually got a brain disorder. UK treatment for drugs and alcohol don't recognise that, and they don't include it in their treatment because for some reason the public perception of addicts is negative, and also so they don't appreciate this new definition, and also policy settings don't apply the new information or the scientific facts that can help addicts get on the real road to recovery. And the way I find this is really, really important because I keep it really, really simple. If we don't understand addiction as an illness, if we don't understand addiction, we certainly won't understand people recovering from it or people experiencing it.